Okay, welcome. Nice to see you again, Grazel. How are you? Good
I'm doing well, Scott. Nice to see you too.
to see you. Yeah, it's always really good to talk to you, and obviously you're very much in the couples therapy space. Um, I think I know your answer to this, but in your mind, is it worth it going to couples therapy? Is it worth all that effort? Is it worth the expense?
I think so. I think it's worth taking care of your mental health in every way. Yes, I think it's worth the money. It's worth the expense. I think it's really good when couples don't have a solidified negative pattern for a long time to go to therapy early on,
Mhm.
because then they can get out of couples therapy with a ton of skills um, quickly than in comparison to someone who's been in a solidified pattern for many, many years, and they come towards the edge of their patience and they want to leave the relationship by then.
Mm.
And if they come to therapy then, when it's towards the end of their patience, then it's going to be a lot harder to get, the secure attachment you're looking for when it's been a while that you've been in a negative cycle.
Yeah,
So yeah, I think it's worth the money.
yeah. Obviously, the kind of the point of couples therapy is to find a way to stay together, potentially when things are really rough and one person's leaning out or things are just not so not so solid in the relationship. But are there any kind of secondary benefits to couples therapy? Is there beyond kind of getting the couple to stay together? Is there anything that they experience that might be a bit surprising, or well, I wasn't expecting that.
Yeah. Um, I think that's the beauty of learning about ourselves, right? Because you really can't tell what you're going to learn until you're in therapy, unpacking some of the things that you never knew about yourself that can be related to childhood trauma,
Mm.
right? That sometimes you may not know that you're repeating in your current relationship. So that's sometimes unexpected information that some couples don't come knowing about.
Hmm.
Um, Other benefits would be like just having the skills on how to talk about sensitive topics
Hmm.
before it gets, difficult to talk about. Um, I think also learning how to communicate based on your partner's way of receiving love and giving love. I think that's also really helpful. Um, I think there's so many benefits to it. I mean, those are the top three that I can name, especially the unconscious parts of ourselves that can show up in therapy is very fruitful to a healthy relationship.
Yeah, and when those kind of unconscious parts come to the fore, maybe someone remembers something from their childhood, or they just have this kind of epiphany of like, oh, that's where that comes from. How does the other partner react when that happens?
It really depends. Depends on where they are in their relationship. If they have a good foundation of opening up to each other, then it's easier to receive anything that may be sensitive for the other partner.
Mm.
However, if there's a solidified cycle that creates a level of emotional disconnection, then, it really depends. Sometimes it can be hard to hear it.
Mm.
And some partners can respond in a way that's defensive. Some can respond in a way that's, receptive. And some can respond in a way that's frozen and shut down. So it really depends on the person and where they are in their negative cycle.
Yeah, I was asking that because I can imagine there's a bit of a softening when someone realizes that about themselves. But you're saying that doesn't always happen because it depends on the person, which makes total sense. Obviously, just projecting my own stuff there. So, how
Yeah.
how can therapy really help when one person's leaning in, the other person's leaning out? We've spoken about discernment counseling before. What's the goal of therapy in that situation if someone's not quite sure they want to stay?
So yeah, so again, discernment counseling is for couples who are questioning whether they want to stay in the relationship or not. So there's got to be one partner who's leaning in and another partner who's leaning out. So if there's a couple and the partners are in that space, in discernment counseling, we call them mixed agenda couples. So, which means that they go to discernment counseling to find the right path for them, whether that's going to be a trial separation
Mhm.
and looking at how their relationship got to this point of separation, or looking at separating amicably, meaning divorcing amicably, or looking at whether they can commit to keeping their relationship and looking at the setbacks that they had.
Mm.
If they choose that path, then they go to back to couples therapy.
Yeah, yeah, yeah. And I mean, for me, it just fills my heart whenever that situation comes in when you maybe one person looks at the other and they say, "Okay, I'm all in if you are," and they say, "Yeah, right, let's do it." And there's just like this move of power in them that it's just like, okay, we're doing this. Yeah,
Yeah,
I love it when that happens. Um,
I think I think what's really important for couples to understand is that if they're fully committed and working on their relationship, then couples therapy is the best treatment approach. If they're having doubts about the relationship, and when I talk about doubts, it's not about a doubt that comes up when you're feeling overwhelmed, when you're disconnected. It's a doubt that feels really true for the partner that says, I no longer can stay in this relationship. That's more kind of towards discernment counseling. So they need to really understand, what does it mean for me to question my relationship? Is it just part of the cycle, or is it because I'm really going out of this relationship? Hopefully that makes sense.
yeah, yeah, yeah. Because when you're in the heat of the moment, you can just feel like, oh, that's it, I've had it, and then 2 hours later, you've calmed down and you think, no, actually, that was just me blowing off steam. Um, that's a very different situation to actually, I fundamentally do not want to be here anymore. Um, you need to be able to make that decision and make that call, don't you?
Yeah.
Um, so, in terms of sort of success in couples therapy, what have you noticed? What kind of traits do couples have who are the most successful in couples therapy?
Um, both partners are committed to being vulnerable and going deeper into sharing their emotions, receiving their partner's emotions, and knowing when to actually step back and not go into a place of defense, um, or criticism, or a space of having a judgmental lens on those are the good traits. So like being compassionate, empathetic, welcoming, receptive, and loving.
Hmm. And if those traits aren't quite present, is there anything you can do in couples therapy to sort of nurture them and bring them out of people? Because we've all got the capacity to do that, but obviously when those walls are up, when the defenses are up, it's very difficult to open up like that, I guess.
Yeah, and that's the great question, right? Because we all have these traits already embedded in us. We are compassionate people, we're empathetic, we know how to do that. We're loving and we're kind, we're receptive. But then when there's been a constant emotional cycle that creates emotional disconnection between two partners, then protective strategies are going to come up and it's going to lessen the empathy. It's going to lessen the compassion that we have. It's going to lessen the loving languages that we use. So in couples therapy, And especially in EFT, this is what we cultivate in our work together, is to bring back all of those traits so that you can create a harmonious, secure attachment with your partner. Absolutely.
And in terms of how that works in practice, are there specific like techniques you use, or like couple relationship building games, or like how does it work?
Yeah, well, we focus on the power of emotions, right? So we really look at how emotions can move your partner to feel empathetic to your struggles. So it's very experiential. It's not something that I um, direct the partner to do. So it's more, for example, if you were in the room with me and you're hearing your partner um, feel angry at something that you did, I don't go in and tell the partner to stop feeling angry. That's not going to work and create a place of compassion and empathy. That's just going to backfire usually. Um, what happens in emotional focus therapy is we validate the feelings of anger and other feelings that come up and look at the meaning behind it, because every single emotion creates a space of learning about what's being hurt inside the partner. So if I go in to look at the anger and say, hey, it sounds like this feeling of anger is really important to you. I wonder what's underlying that feeling of anger. Validating that feeling creates compassion. Validating that anger creates empathy. And then having the partner witness that it makes sense to feel angry so long as it's not a place of, so long as the partner is not using anger to blame or criticize the other partner or belittle the other partner, then yeah, I can cultivate a space of empathy and compassion for that.
Yeah. Yeah, and I mean, I suppose one of the most empathetic, compassionate things you can do is to say, I see you, and it's okay for you to be this way. And I know, thinking about like individual therapy and
Yes.
parts work and things like that, it's all about recognizing that everything that you feel is like there's a positive intention behind it, and you just need to make sure you understand what the intention is behind the feeling that you're feeling, in order to make sure that you're not going to displace that feeling in an unhealthy way, if that makes sense. Like if I'm feeling angry, that's because something has happened that doesn't sit right with me. That's an okay thing, but it's not okay for me to lash out at my wife because of it.
No, that's when we go to a place of this anger is no longer constructive. It's destructive to the person that's feeling it and to the people around them. So, I go in and help them understand that so that they're not struggling so much.
Yeah,
Yeah.
absolutely. Um, and obviously, coming into couples therapy, I imagine people are in all sorts of places. Some might have really high hopes. Some might be thinking, "Oh, this isn't going to work." How do you sort of manage those expectations moving forwards?
Expectations when coming into therapy is so important to discuss, right? Because a lot of people don't really know what to expect in therapy unless they've read up on it. But even then, if they've read up on it, I mean, yeah, there's a lot of information online now, especially with AI, but it's still very important to discuss what it looks like in the room, right? Like for couples that are coming f- in couples therapy, there's a risk that they need to understand, a risk that they may feel certain feelings that are unpleasant and they may not like it,
Yeah.
right? And you have to talk about that as the therapist, and clients and patients have to expect that because we're uncovering things that maybe have been suppressed or have been put aside. And in order to heal and bring back that connection in your relationship, we need to look and attend to those feelings that haven't been seen or attended to.
Mhm.
So that's one expectation. Another expectation is knowing that if the therapist assess that couples therapy is no longer useful, that the therapist will end therapy for reasons of like abuse or addiction or any affairs. Also, they need to expect that it's usually a once a week commitment because it's really hard to track a negative interactional cycle between partners when you're coming once every 3 weeks. Or it's not, I mean, I don't I tell couples this. It's a lot easier for me as your therapist to be able to track what's going on in your relationship if you're able to commit to meet with me once a week, because then I can give you a quicker time
Mm.
in understanding what's going on in your relationship versus if you come every other week or once every 3 weeks, I can't really do much with that,
Yeah. Yeah, you need to
right? So they need to know, they
you need
need
to
to
understand
expect
the
that.
couple. Yeah. You need to be able to understand the couple. You need to be able to get in there on a regular basis. Otherwise, I mean, I know your memory is pretty good, but it can be very easy to forget what happened 3 weeks ago and really bring it back up and unpack it. Yeah.
Yeah, it's not just, it's there's a lot happening in every week. There's so many interactions that's happening every day between couples that if you don't attend to your relationship on a once a week basis, things are going to pile up. By the third week, you probably had already 10 fights and we can only talk about one fight.
Yeah.
And you're going to be very upset that you didn't get to talk about all the fights that you had because we only have 50 minutes. So that's kind of something to expect too.
Yeah. All right. Well, I think we'll have to leave it there just because of time. But thank you so much for your time again, Grazel. Really enjoy speaking with you. And yeah, I'll speak again soon.
Okay. Thanks, Scott.